Hello, this is Ellen Madono. I'm speaking to you from my home office in Kamakura, Japan. Today we're going to talk about strategies for finding a curative remedy. I hope you will press the space bar on your keyboard if you are not a speaker of English as your native language, or you'd just like to have a little more information on your screen. The topics for today cover an Indian woman's experience with homeopathy and how she studied homeopathy. I'm just going to give you a short excerpt from that interview.
First, the minute you say homeopathy, they are like, oh, that doesn't work, or that a lot of misconceptions, that it takes a long time. Because another thing, when I was like maybe 5-6 years before, I'd been to homeopaths and for some problems, and they took a really long time. Maybe they were giving a very low potency, I don't know, because they want the client to come every month. They want their income. So over here, at least, they'll not directly give you something which will work. Actually, it should be that way. That and so then what they get on the first hand, they tell you that okay, it's going to take a long time for this, so be patient and you'll have to come every week and all. Then finally the patient only gives up. Okay, how many days am I supposed to take this remedy? It's not working. Maybe if it's a skin problem or something, like how long am I supposed to take it? So it goes on for years, and some of them like take very high fees and they do nothing. So then what happens is, because of these people, you lose your faith in that medical system. When the homeopathy itself, I know now, today I know it's perfect, but the people who are practicing it, they are the problem. Rather than the medicine itself. Because if I know, my father has asthma, so one time he had been to a very famous homeopath in my city and he gave him a steroid in the homeopathic medicine, and he got a very bad attack. Now after that, I don't think he would go to homeopath again, because then the mistake is of the homeopath, not of homeopathy. Because
Preeti decided to study by herself, and she's very capable. She selected the most basic materia medica. Really, this is the foundation of any modern materia medica that you would find. Anyway, I find these books to be kind of difficult to read, just because they're such they're distillations, and if you don't have a lot of experience with homeopathy, at least for me, this never was easy reading. But she seemed to have been able to read from cover to cover, and furthermore to have retained it. And we're going to talk about why she retrained some of this. I'm a little bit not. I'm not. It's not as easy for me to read homeopathic literature. And really, the Kent's lectures on homeopathic materia medica were the easiest things for me to read of the traditional literature. He writes in a very easy style. Kind of, if you overlook the time when he starts just naming symptom after symptom after symptom, that's hard to use. But I keep Kent's Materia Medica on my desk because it's still very useful. You know, this has gone through 20 years, and it's a Indian version, and I think I bought it secondhand, and still it's very useful. Chaudhry is another one that's very useful now. I'm not sure that it would have been useful back in the day when I was just beginning homeopathy. But I always found, I don't know why, but I found the writing to be entertaining and easy to read. E.B. Nash is hands down the easiest. He writes really well, and his cases, his descriptions are all very vivid. They're easy to remember. Douglas Borland is another one that I just love his writing, and he's easy to read, easy to remember. This homeopathic practice one I have in paperback, but you know, I've found these on the net. They're anywhere, because these people are long since dead, and you can find them as ebooks and all kinds of different forms. This one, Yasser Yagers, homeopathic dictionary is a must because there's lots of kind of Victorian vocabulary, but also very technical vocabulary of another age. But usually you can look these things up on the internet, and you usually find that vocabulary on the internet as well. Sometimes it'll come up with an old book. So I think when I began homeopathy, computers were not quite as useful as they are now. And Preeti says she finds the right remedy every time. I'm just astounded. She's taking fairly difficult cases and she finds the right remedy. I don't find the right remedy every time. I find it much more difficult than that, but other people could be a lot smarter than me. I don't negate that possibility. But I think for the normal person, the cases are not taken in a very deep way, and remedies are switched quickly before you get much out of them. But also the way they are working is fairly superficial because the case taking is superficial. So novices do this, but regular homeopaths also do this. It's very hard to know a patient. And so I have to slow myself down and let remedies work. And if you keep on switching remedies, what you're going to get is confused energy. In allopathy, they'll confuse not your energy, but they're going to confuse your physical body and cause things to happen that aren't intended. But for a remedy, actually, you're going to confuse the energy, so the next time you want to take a case, you're not going to have clear symptoms. And for a homeopath, that isn't a good situation. So for different reasons, you don't want to be giving this medicine and then switching to another and going back and forth, back and forth. Okay. Now, Preeti says in her interview, she says that no one's interested in homeopathy around her. And actually, that's very true for me, too. Nobody around me is interested. But if you go on Facebook, you find it looks like the whole world is interested in homeopathy. I mean, these are small groups, relatively speaking. There are many, many, many more than this. These aren't the groups that I participate in, but I just tell you that there are so many groups and people are so interested in homeopathy because, like Preeti says, she knows it works. And there are also people who are asking, does it work? But people have a lot of difficulties. They have a lot of difficulties with homeopathy, and they have difficulties with medicine, and they have difficulties learning homeopathy. If you go to a homeopath who doesn't teach you about homeopathy, you're really missing half the treatment. You should be learning about homeopathy when you go to a homeopath. But at the same time, you're only going to be interested in learning if you yourself already assume that you're taking responsibility for your own self-care. And often I think because of the way we're treated by doctors and by homeopaths as well, they kind of assume all the responsibility, so you lose interest in your own self-care. This is a bad result, I would say. I would be proactive to avoid this situation, being buried in pills. Now, Preeti has pretty much discovered that there are a lot of books on homeopathy, and you really can be buried in books. But actually, when you've got a case, analyzing what the problem is a big problem. What the disease process is, which tissues are involved, and sometimes you don't know. homeopathy can be done without knowing everything clearly, which is a big help. You don't have a disease name usually gets in the way. And then you also have people with multiple problems. I don't think PT was dealing with these kinds of people because it becomes very difficult to analyze it isn't the problem, it's the end result of having many problems. And where should you be focusing becomes the question. So there are multiple approaches to this kind of disease. And then there's also kind of generalized problems that don't have clear symptoms. Something like depression. This is a big problem. And sometimes when you have a small physical problem and you work on the physical problem in a deep way, actually something like depression will be cleared up. But you have to have a homeopath who can go deeply enough, because everyone's taking medications. Everyone has been vaccinated. So everyone has suppressed symptoms. We present with certain symptoms, but below the surface there are other problems that have been suppressed, and those need to come out in order for us to recover. I'm still working on this kind of thing for myself. And then Preeti also talked about very specialized kinds of remedy types. And I think there's a place for learning this, but this is not like the beginning of homeopathy, I would say. What I'm trying to offer here is something that is very good for beginners, but it's also very good for very experienced people, because it can help to speed up your process in the office. So, and then Preeti mentioned a lot of literature when I was talking to her. She'd read all kinds of books. But one of the problems with reading all kinds of books is figuring out, where are people coming from? How reliable are they? What kind of situation were they in their era? Is it the same for us? These kind of questions need to be addressed. And then you need to have the time, the aptitude, and the patience for study. And everybody doesn't have that, and I don't think it's necessary to assume that. So at different levels, I think Preeti can go really deeply. But there are other people who are just, you're taking care of kids, you've got sick parents, whatnot. You've got a job, and you can only go at a less deep level. I think that's fine. And if you learn about homeopathy at any level, it will be valuable for you in your life. So what I'm going to suggest, really for everybody, for the professional, for the busy mom, the person who's busy with their work, anybody can learn polarity analysis. And I'm suggesting that it's a way to go deeper and to get more reliable results. It's really based on classical homeopathy. What does that mean? You consider the whole person, and you consider the whole person using a manageable amount of information that is clearly visible in the symptoms of people, and the instructions are very clear. I encourage you to go to the creator's site of Polarity Analysis, Dr. Heinner Frei, and listen to his description of it also, because he gives a very, very clear description when you realize what he's talking about. In polarity analysis, there are several different strategies, obviously, and it's good to know that. But most of all, this method is very practical, and it can be used very easily for your rather narrow personal problems, perhaps. You're not a professional, but it still can be used in a non-professional situation. Why is it such a first-line simple strategy. By first line, I mean it's the first thing I do with patients when I don't know much about them. Okay, in the process of working with a patient, of course, I'm going to learn more about them. But at that first line place, I don't know too much. So I really need reliable data. I'm not going to get it from the patient easily if I'm not myself extremely clear. And I need very obvious, observable symptoms. Something physical, not something that's in their head. It's very hard to look inside people's head as a first line strategy. Sometimes it's easy, but not usually for me. And this is also a method that eliminates some of the candidates for remedies, which really helps, because if you're not researching too much information, it's easier to come to a conclusion. Okay, so this is holistic medicine. That means this is the business of dealing with the whole person, getting a sense of what is really central to this person, which is a little bit different than the using polarity analysis as an analytical strategy. It's something that's kind of very big, and it's really the basis of classical homeopathy. So you're on one hand you're getting a big sense of a person, and the other hand you're looking for very focused, observable symptoms. Okay, so this is what I am going to suggest. So first, I think we should understand how homeopaths understand diseases. I'm just going to give you, this is not a total explanation of how homeopaths understand disease. It's kind of, I think it kind of make you, if you don't know anything about this, it might make you feel uncomfortable because it's not the same as the way doctors think. But I want you to think, to be realizing that you're thinking about something that is not the way doctors think, ordinary doctors think. So the first thing is that there's something called a miasm, which are the characteristics of diseases. And so this is just a simple map, just 3 of them, And one remedy has been divided into 3 disease types. And the characteristics of that remedy, the symptoms that come from that remedy, the rubrics we call them in homeopathy, these can be separated in 3 different types, is the argument of this author. And when you're doing cases, you're thinking about what is kind of the fairly surface level, what is kind of the patient is kind of overreacting, and the patient at the same time is being destroyed by the disease process. So these are simply being categorized into those 3 categories, something fairly superficial but totally overwhelming the patient, something that is an overreaction to problems and destruction. It's very basic in homeopathy, and it's the way I think also. Now there's a homeopath named Will Taylor who took a dictionary of homeopathic symptoms. They're called rubrics. The symptoms have been sort of boiled down into something that is kind of generic for many different patients. And he threw them on a table, put the cat outside the room, and put all these symptoms into categories here. And described how one remedy, phosphorus, could go from each of these states and one to another, to the next, pretty much in a cycle like this. Maybe having fears that cycle back and forth. They need reassurance, they have fears, they need reassurance, they have fears. But a cycle of getting sicker and sicker and feeling more and more not themselves. Okay? So we use something that's called a repertory, and this word is going to come up more often. It's really a dictionary of disease symptoms. And another way of thinking about a disease is that there are many different phases to a disease, any specific disease. In this case, Paul Herskew was looking at autism. This was taken from his book Stramonium, and it covers the different phases of autism. In the beginning, we all have certain ways that we compensate for the stresses of life. And this compensation stage, certain remedies are a kind of, they're not that sick. And many people can use them because most of us are kind of getting through life by compensating. Okay? And then when we get sicker, we kind of become, we succumb to the tendencies of our heredity or to our family or the way our physical body is. I mean, there's certain tendencies that we have, and we go in the direction of certain remedies. In other words, a disease is described by certain remedies here. So this gets a little bit deeper. And then problems begin, and we begin to say, oh, this person is autistic. And they're autistic in the withdrawn kind of way, the yielding kind of the way, the kind of, I don't know what to do kind of way. Or they're autistic in the out there punching and mad and just reacting to the world. This begins at this stage. And then finally, the ones who are Bardia Carbonica go into a much deeper kind of stage where they're really not able to deal with the world at all. And they're definitely, clearly autistic. And you might notice in here, if you know anything about homeopathy, that a very common remedy, arnica, is at this deep stage. Oh my gosh! It's because we're talking about remedies in the context of a specific disease. That this very, very common remedy for cuts and bruises and all the injuries we have is way down here at this deep end. Okay? And if this is for the people who just withdraw and they can't deal with the world. And then there's the Stramonian type gets deeper, and they go into this deeper state here. And this is the hyoscyamus. I just gave this remedy the other day. It's kind of fun to see it here because it fits. But they're overcome by the disease. Okay, so you can see the phases get deeper and deeper. So we're talking about diseases, but we're always talking about remedies at the same time. This remedy is getting deeper and deeper. It's on the surface. It's superficial, but it's overwhelming the patient. They're getting stronger and stronger reactions, reacting to the world, and finally getting destroyed by the stress of the world. Okay. Now, if you want to talk about another context, okay, we talked about autism just now, but flu is another context. And you see lots of charts like this, that if you have this remedy, then for fever it's chilly, and for pain it's this way, and they go on and on and on and on. Okay, so you have these kind of symptoms, and it's this way. Okay, and we kind of know a lot about flu. Okay, so we have these charts that typify how these remedies work. Can you find the correct remedy by using this kind of information? Why isn't this good enough to find a remedy? What use is it if you're not going to be able to find the remedy? Well, you can ask that question. Certainly, it's one of the best ways to study a remedy is to think about the context of disease and to think of similar diseases. When you hear lectures, various lectures on homeopathy, you're always seeing this comparison of this remedies, this disease state and that disease state, how deep it is, what phase are they in. Now, Preeti is worrying about having to treat COVID with homeopathy, and rightly so. We are all thinking about this. I'm going to address this question and suggest how to study COVID, how to prepare yourself for the first stage of COVID. Okay, so COVID has this kind of development also. Okay. And what I'm going to suggest is that you use polarity analysis. Why do I say this? Why am I just pushing something? I mean, I don't even know Dr. Frei. I'm not getting anything out of it. I just really believe that this would help a lot of people. So you can learn polarity analysis to protect yourself against COVID. The reason is that if you can find your chronic remedy, this is the best defense against COVID. If you haven't been using medication, of course, your immune system is stronger, and you're going to have fewer chronic symptoms. So in my case, this is not that easy to find the chronic remedy. Of course, I'm always interested in looking. The reason why I'm going to suggest this is not because you could do this, because this is not that easy to do in the beginning unless you're sick. You can't be sick and studying this at the same time. That would be difficult. The reason is, what you want to do with homeopathy, if you're dealing with fairly healthy people, is to heal the first symptoms of COVID. Later stages, of course, homeopathy works, but you want to be ready to heal the first stages, okay? And what I'm going to suggest is that anyone can learn to treat flu, which means that anyone can learn to treat the first stages of COVID. So I'm going to give you a comparison of treatment of flu and treatment of COVID. Now, Preeti is already successful with recent colds and flu symptoms in her family. So she has told me about this, and unfortunately I didn't get a good recording. I kind of got an insight into how she goes about it. She's much smarter than me, so I was impressed. She doesn't use a repertory. What I would suggest is that you use a repertory. I'm using it's called the 5-finger method, and I think you put bookmarks in there, just tear up paper and put the marks in there for the symptoms that match your case, right? And so this is what I would do, okay, is I'd use the 5-finger method. But Preeti's method is a little bit different. Her method is, she has a headache, a cough, and a fever. So she looks for the remedies for headache and looks for the headache that is most like her headache, and she comes up with one remedy. Then she has a cough, and she comes up with one remedy for the cough. And finally she has a fever, and she comes up with another remedy. So she has 3 different remedies. How does she solve the problem of knowing which remedy to take? It isn't a problem if she says, well, I just take one, and if that doesn't solve the problem, I take the next one. And if that doesn't solve the problem, I take the next one. I didn't get to ask her, but I asked her, how long do you wait? What is the right amount to wait? Don't you have any more important symptoms in a case? She doesn't seem to have a plan. And I think trial and error often works. My first experiences with homeopathy were purely luck. And luck was just wonderful to me. Once I began to think about it, I found out that homeopathy wasn't that easy for me because I was thinking the wrong things. But anyway. So what are the problems with a trial and error method? First of all, if you have a slow moving condition, it will take at least 4 hours to verify if the remedy is working. It could take 12 hours. It could take a day. You know, if we're talking about the flu, we're not talking about chronic illness. We're talking about the flu. And another problem is which remedy worked. I want to know which remedy works because I want to learn something from every case. Every case I take should make me a better homeopath. That's the way I see it. Another thing is, Preeti says she doesn't fail, but I would fail often. I know because I have failed often. But maybe her patients never took drugs. Maybe they were extremely healthy. I don't know. But I would, if I had no plan, which is what I did in the beginning, I would fail often. Actually, I wasn't as, Preeti's wonderful because she tries and it kind of works, and she tries again and it kind of works, and you can actually do that. It's okay, you can do it, and I think it really does work. I don't doubt that she is successful. I think I'm just a little bit of a chicken. I'm too hooked on this idea that I have a method. And Preeti's attitude is actually something I could learn from and be a little bit more easygoing. Okay, so I'm not really down on Preeti. I think that this courage and this willingness to try is essential. Okay. But I want a more reliable method. And I have plenty of failures, so I really want to know a better method, and I want to learn from the process. So I want to have a method that I repeat over and over again so that the process can teach me more than I knew before. Okay? So I want to know what I did and why. I keep records. If I'm repeating kind of a similar method, at least in the beginning, as patients, as you see patients, the same patient for a longer period of time, things get much more, they're not as easy to understand, I guarantee you. Okay, but if you're treating COVID, you're treating something that is just happening suddenly now. Or if it could be a suspected COVID case, it doesn't really matter. And if Preeti were treating COVID, there's a good chance she would fail because it's not very forgiving. Okay, COVID is responding to a virus in the beginning, and the progress of the disease is much faster than the progress of disease in a flu. Okay, I'm told. I have no experience, but this is what I read. And this is the time when you want to treat it, okay? You can treat it here and you can treat it in the hospital, but the hospital won't let you in, for one thing. And this is, it's getting dangerous, and you really don't want to be failing, and you don't want to be doing something difficult. But here, you're not doing something difficult. So here, you really want to treat it, and you want to treat it well. Okay. You understand that in the hospital you're having organ failure, and the cells the whole system is becoming inflamed. So you're dealing with something that's much closer to the chronic disease of the patient. The reason why things are going in the direction they're going is because the tendencies of the person are already there. Okay. And this is time, here with the lungs and the blood, you're still at home. But you can't afford to miss, and you can't afford to be slow. Okay? So this is your prime time to be using homeopathy and to be using polarity analysis. Actually, you want to have more experience when you get here, But, life is not order made as far as I can tell. Okay, so we had this nice little chart here. So why couldn't I just use a chart of flu remedies? Why couldn't I just study this? Actually, I'm going to tell you that this is a pretty haphazard and unreliable way to treat COVID. And the way I'm going to explain this is by describing my own flu case. And in my case, only Rhus tox, which was my beginning remedy, was here, right? This is the flu. This is not COVID. But I think you can transfer the ideas to the COVID situation, okay? So, first of all, if I looked at this chart, which I never do, this is the only remedy. The only remedy was in the beginning of the flu, okay? What you'll find is that in my treatment of the flu, I used a very reliable repertory. I wasn't using polarity analysis, and I think a reliable repertory, even without polarity analysis, will be a great help to you, okay? So this is the situation I was in. I had visited some relatives and we had traveled on the train. I have a hard time sleeping in a place that's not home, and I was stressed with my relatives, etc. So I felt sick when I returned home. It was the middle of winter, flu season, and I had a fever and my whole body hurt and my joints hurt, okay? And I was very chilly, okay? So I was better from laying down, better from after just a little movement. And I was really not feeling well at all. But somehow I got in bed and I found this scrap, I think, of cardboard or something. And I had this book with me because I'd been looking at it for quite a while. And I managed to repertorize my case and find my remedy. Actually, there's one thing here that's it's the giveaway, because my joint pain was better after a little movement. This is it's called a keynote. This means that it's definitely it's a sharp pointer to this particular remedy. This one, Eupatorium perfoliatum, also has a lot of joint pain, and so does Bryonia. But this better after moving around. When you get up out of bed, you don't feel good, and then after you walk around a little bit, you start feeling your joints feel better. You don't feel better because you're pretty sick already, but you feel better than you would have felt. So anyway, I used this repertory. It's it's not your typical repertory. Typical repertories they're all in, this is the Materia Medica. I don't have a repertory here. They're all in fine print. Everything is fine print, and they're packed and they're thick. So here's some particular. This one. At the time when Boenninghausen made this repertory, people didn't have this idea of how to make a thin repertory, and people didn't get it. I didn't get it for the longest time. I just couldn't understand what was different about the Boenninghausen method. It's this repertory. It's how the repertory is constructed. I don't have time right now to explain this to you, but people were piling up closets of descriptions of remedies. They had no idea of a repertory. Now we have a computer with huge databases in them, and nothing compared to this skinny little Boenninghausen pocketbook. It's called the pocketbook. So anyway, I had this, I remember laying in bed, holding it over my head and looking for the right symptom. And what I did was I wrote down the rubric. Does everyone remember what a rubric is? A rubric is what you find in the repertory, and it represents a lot of people who have the same symptom, and then it's kind of boiled down, like maple syrup is boiled down into a much thicker meaning that kind of covers everybody's experience of that rubric. Many different symptoms are combined together in that rubric. And so I wrote down the rubric name, and I wrote down the name of the remedy. There's only 125, so I didn't have a piece of paper like this, but I just wrote down the names of the big remedies that were on the top. And I had to think, what remedies do I have at home? I couldn't get a remedy, write down a remedy that I don't have. Some of these remedies I don't have. I don't have these. I have most of them, but I don't have a few of them. So, and then I added up the grades. Grades are this, most of them are kind of 1 to 4, and there's a few that are 5. And the higher grade ones have a proving and a clinical symptoms in them, okay? And the lower grade ones are only clinical. This doesn't mean that clinical information is not important. I'm going to have to teach you that later. But these higher grades get more points, and you just add them together. So it's just addition. Even when you're very sick, you can do this. And this is what I did. I didn't have such a thing as a laptop at the time, and I just couldn't get to the place where my computer was. It was far too cold, and I just added it all together. I found all my remedies, all my rubrics. I didn't even have a 5 fingers or other piece of paper. I was just in bed with a piece of cardboard and scribbled it on that cardboard. My flu case was over in 3 days. I avoided pneumonia. 6 months before, oh no, it was a couple of years before, I had the same kind of flu kind of thing, and it took me 6 months to recover, and I didn't use homeopathy. So I'm really pleased that I used homeopathy. I think Preeti would have taken care of this. She wouldn't have been like me. I didn't have any confidence that I could find the right remedy before I learned Polarity Analysis. So I wouldn't wouldn't even try. I know, very lame, but some people are not as confident as other people. And so, if you don't recover quickly, it means you don't have a very strong vital force. That is, your energy to heal is not very strong. Okay? So I would say that this was excellent results. So I'm going to explain the situation. I can't remember the accurate symptoms because I wasn't thinking of teaching this at the time, and I didn't keep notes of my personal experience. My sister's a seamstress, and she uses safety pins to close off her pants when the buttons come off. I'm kind of the same way. I don't take care of myself. The worst kind of homeopath, yeah. So what I must have done was the watery discharges. There were many remedies, and Rustox just stand out. Wanting to lay down, Rustox came out 3, and Pulsatilla came out 2 as grades, right? This is what I was talking about here, right? These are the grades. The thing was the arthritic pain. Okay, I was telling you about how you get out of bed, and as soon as you move around a little bit, you feel a little bit better. These kinds of arthritic pains are in here, but that particular keynote is not. But restlessness is. And this is kind of a restlessness. You're moving around because if you move around, you feel better. The other remedies that I ended up using didn't come up very high. This is not the way you repertorize. This is not I'm kind of thinking back on the remedies that I used and just trying to think, why did this one stand out? Okay. It stood out among many other remedies as well. But this came up with a higher score, and I took Rus-Tox, okay, which is a common flu remedy. We just saw it in that list. And then symptoms changed. Now the question is, if I were the patient, did the symptoms change? Are the symptoms changing? Okay. Well, I just intuitively thought my symptoms were changing because suddenly the coughing was becoming suffocating. I couldn't breathe. I'd be coughing and I couldn't get a breath because of this sticky yellow sputum that was in my throat. And you notice that the next two remedies I took were number 4, grade 4, and there was no expectoration. I couldn't spit it out, okay? And I was worse lying on your back. Of course, you're worse lying on your back. I don't know what else there was in here. There had to be other symptoms because this kind of isn't enough to do a real case using the Boenninghausen Repertory, using this repertory here. I don't really believe that's enough. But, I took pulsatilla for some reason or other. And then the next night, I was even worse. But now all this mucus had gone from my sort of in my throat and my sinuses into my chest. Now, if you read a little bit about pneumonia, you'll find out that going into your chest is bad. This means that you're getting worse. So there was no doubt in my mind that I was getting worse. But this is very fast progression because remember, I had spent a couple of days before even taking the Rus-Tox at my relative's house feeling sick. Okay, I'd already been sick. Finally, I took the Rus-Tox and suddenly my symptoms started moving. This was not going to take 6 months the way my past flu had taken. Okay, so I got this chest congestion, and I couldn't breathe. Okay, phosphorus and pulsatilla both have that. So breathing was difficult. They both have this. I coughed, and I couldn't get anything out. And phosphorus has this more. And I was cold inside. And outside, I could feel the fever. The fever was, I was cold, hot outside. And this is a particular rubric in the Boenninghausen Repertory, which I kind of like this one if you have this one. And then I had to lie on my side. Remember, it was worse lying on my back. And then my skin was dry. And then I had blood in my sputum. But I thought this is great because phosphorus is famous for bleeding. But if you look here, it didn't help a lot. But one thing is gland inflammation, and I've always had gland inflammation. And actually, after I did this, my gland inflammation went down in some parts. I still had some, but it went down considerably. So my general health level went up because gland inflammation has been a general problem for me personally. Okay? So, this doesn't really look like enough information to give me phosphorus. The only one that's really different is this one here. And this one. But this is not an impressive result. So I had to have other symptoms that I can't remember. Okay? My patients all forget their symptoms, and I forget my symptoms. And furthermore, I don't think about them again. This is just human nature. Total weakness. So I got better really fast, and I was very happy. Now, we're going to start talking about COVID. And in the case of COVID, accuracy and speed are essential. Okay? This was flu, right? And this was flu that I got through with 3 different remedies, and I was going to have pneumonia, and I escaped pneumonia. Pretty good. But this is just flu. This is COVID. You're getting more serious. Okay? The possibility of your organs being affected, in my case, the glands would be affected, is there. And you want to take care of this quickly, right? In the beginning, your body is really fighting with the COVID virus itself. Later on, it quits fighting with the virus and you start to have your whole body's general inflammation. Okay, so in the beginning, you should have some pretty clear symptoms. And I think all of you know this, that COVID and influenza are not the same thing, especially this shortness of breath and the breathing difficulties, and then there's a loss, the taste changing, and some kind of weird symptoms also happen. So we're talking about two different diseases, right? So definitely you do not want to use this chart. Knowing how to take care of flus, however, will definitely help you with knowing how to take care of COVID. Can you just investigate all those remedies that aren't on the chart also and find the right remedy? I wouldn't suggest that. That's too chancy. No, you don't have enough time. I could barely hold this book over my head, add up 3 plus 4 plus 2. It was very difficult. So I'm really glad that I had this book. And I hope that you will consider not buying this book, but learning how to use a repertory. This book costs I think it costs $75 or $100. I don't know what it costs right now. And only limited editions were printed. I'm not sure if it's being sold. You'd have to look into it. The writer of it is George Demetriadis. It's very important that it is researched. This is Timothy Allen, wrote the original therapeutic pocketbook. And George Demetriadis found all kinds of mistakes in it. So when you look at this book, like starting about halfway through, it's all these notes, these tiny, tiny letters, a description of one at a time how these rubrics are backed up by the writings of Boenninghausen. Okay, and he goes into all the different literature that Boenninghausen left behind and checks and rechecks it. And if you read about Boenninghausen writing this therapeutic pocketbook, also he checked it, but he only had, I think, one time to check it after the publisher printed printed it out for him to check. But he only had one time. If you did that with a modern book, you would never get accuracy. So anyway, George Demetriadis, and there's a German man who is also independently has checked this therapeutic pocketbook in great detail. So you don't want to be using this, okay? If possible, use this, if possible. It's available. The old one, Timothy Allen's book, is available on the web, and there's free software available for this book. This book is by Boger, and it's written long after Boenninghausen had died. It is not, I don't think he completely understood Boenninghausen's way of thinking, and there's a lot of criticism of it. However, my teacher said he memorized this book, and he can do cases in his head without looking at any repertory because he knows this whole repertory. So I'm certainly not going to sniff at that. I mean, it must be a pretty good repertory. At least it must be accurate for the top grade remedies. There's a free version of this. Okay, there's a free version of this. There are computerized versions of this one here, but I would not use those computerized versions thinking that they are the same as polarity analysis, because Dr. Frei goes over those his polarity analysis and keeps changing it and keeps working on it. He's very devoted to it. I didn't get the same results when I started comparing the two. And furthermore, you have this short list of symptoms that you are advised to use, and you don't get the same results. I would feel, you can use this or you can use the computerized version, but you're not getting as much help as you would be getting with polarity analysis. And I'll be explaining to you how you do that. Okay. I would use polarity analysis as my first line of action. It's the fastest and most reliable method. And then I would check with Boenninghausen's repertory, or with the Boger-Boenninghausen repertory, or the program or something. I would check with another repertory, or with my big, huge repertory. I check with that too. And you check with the Materia Medica. If you yourself are sick, you want the simplest method possible. Okay? If you have somebody in your house who's sick, you also want the most reliable method, and you probably want a fast method, because sickness it takes a lot of effort in many different areas. In many of the repertory software, you'll find this really it's there. This repertory is in the software, okay, and you can get a free version of this repertory. Okay, this is not free at all; it's expensive. But they're not the same as what's on the internet. I don't know the details. It's just I didn't get the same results, so I don't believe that they're the same. I'd like to tell you a little bit about Preeti and how it is that she happened to teach herself homeopathy. I thought she's so impressive that I just want to talk a little bit more about her. She taught herself homeopathy by reading about it. I've done the same thing, but not nearly as effective as her. Wow, I was just overwhelmed. She was very disappointed in both homeopaths and allopathic doctors because she found that everybody was doing allopathy. And then she really began to think about what is homeopathy, okay? And one of the things that I kind of felt was not too clear in her mind was the definition of disease in homeopathy. How do homeopaths think about disease? I don't think I've clarified that completely, but at least I want you to get you to have a beginning to think about that question. And then I suggested to Preeti that she learn polarity analysis because it's relatively easy and reliable. And I suggest to you that you either learn the thin pocketbook repertory, or you cross-check it with other repertories. You can learn these, but the first line of action is the polarity analysis. If you don't have this all mastered, it's okay. But you need to begin. You need some cross-checking. I'm sorry, but you probably do. We had this problem of no plan, right? There's software for a bigger repertory that's available. And Preeti's plan was to use the 5-finger method and it's a very good plan. Everybody doesn't have these big computers, and I don't think that's necessary. But Preeti had something else on her side. She is the daughter of a doctor, and when she was a kid, she's now a young mother and not a kid, but she would sit in her mother's office, and her mother would have patients coming in with cholera, malaria, jaundice, typhoid, typhus. She said she herself had typhus and jaundice. So she was hearing all these disease types. She was looking at the patients. She was totally there. I think she probably studied very well because she seems to be a very good student. But all of these diseases are what we call miasmatic diseases. I told you about Sora, 3 different disease types, big types, but all of these infectious diseases are used to sort the kinds of phenomena that we find in homeopathy. Okay, so what Preeti was listening to was very important. And I have to tell you that me as a beginning student, I would read about cholera or typhus or typhoid, and I would just be like, oh my God, I am never going to see this kind of disease. That was my mindset. So I kind of had oh, okay, I don't have to think about this area at all. But actually, these disease types at later down the road, after you've learned a few 50 remedies or so, then you want to begin to pay attention to these disease types because they're very useful. So Preeti's ahead of everyone because she was just a very observant little girl. Okay? And the reason why these disease types are important is because when people get an infection, they go through primary infectious stage and then the primary and secondary stage, and then they get the latent stage. And so what we are listening for is the nature of the latent stage, okay, of these diseases. And without a doubt, what's going to happen is COVID is going to leave a very strong mark on some people's lives. And they're going to be affected by COVID also. So COVID is going to be one of those miasms. Okay? And we are going to be helping people recover from post-COVID. Okay, and so those are all what we call miasms. So I'm just giving you I'm jumping way ahead, way ahead in your study. But I think getting a sense of the field and how large it is very useful because you don't have to throw out things that you don't understand now. You could just say it's for later. Okay, I hear you. I'm taking it in, but I'm not worrying about it. And that's a good position to take. I hope that I'm motivating you to learn polarity analysis so that you can have small successes early in your practice. And if you are a professional homeopath, I certainly hope you will learn polarity analysis yourself and teach it to others because it is something that beginners can all enjoy small wins from. And this will give us more understanding of homeopathy in the world, which I think is a great plus for the world. So I'm hoping that you will press that subscribe button and let those bots know that we are working on something that is very important and that you think is important. This is Ellen Madonna from Tokyo Homeopathy, and I've gone over some strategies for finding a curative remedy. I hope that you all enjoyed it and it will motivate you to begin studying polarity analysis. Thank you.